In this video, I would really like to cover the topic on how to fix the herniated disc, actually how to alleviate symptoms from herniated disc, and why you should never do the exercises from the internet that you can stumble across in the YouTube. Like, there is so much popular videos from different physical therapists that are suggesting you to develop spine muscle extenders and to develop your lumbar lordosis, and somehow these motions are meant to alleviate or heal your damaged disc. So also I will show you what you should do instead, and I will show you few motions and few principles and conceptions from Prostate Restoration Institute that I've been using for the last 4 years with my patients and with myself as well. And at the end of the video, I will tell you when you should not do any kind of exercises and what to do better instead. Are you ready? Let's go. So first thing first, extension. Why extension might be bad for some of you for treating your disc herniation. There is actually a study that being done many years ago. They took hundreds and hundreds of people. All of them were presented with the herniated bulged disc, and they put all of them through MRI scan, and they took 2 shots. All of them were actually in upright position standing, which is unique, and they took 2 shots. One shot was in the neutral position of their spine, meaning slightly flexed forward, and another shot was taken in the overly extended position of their lumbar spine with a huge lordosis. As it turned out, for half of these people, the lordosis and extension was associated with increasement of the already available disc herniation. Just take a look at this picture. As you can clearly see, with more neutral, aka flexed back, the disc herniation protrusion was smaller as compared to the extended back. That's why in my practice with my patients, online, offline, doesn't really matter, I never suggest to do extension exercises, because I know if you have disc herniation, this extension might hurt you in the long run, also in the short run. I'm not gonna risk giving you any kinds of McKenzie protocol. However, I do believe that strengthening of your lower back and your core muscles might be beneficial for you. Why? I'll tell you why. Because when you are healthy, you must do anything to increase the strength and stability of your core, because it supports your lower back. However, when you already crossed that border, you went through the border, you already destroyed your disc, it's kind of too late for most of you. Yes, some of you will reap the benefits of these exercises with hyperextension. But me, I'm not that person. I was never able to feel any kind of relief out of these motions, just like my patients. So what to do instead? We are suggesting to do PRI exercises, because we see the problem of the lumbar spine as a reflection of your bad alignment of your pelvis. You are not a worm, you are not a snake. Your back is driven by the pelvis and lower limbs, and your upper back is being driven by your upper limbs and your ribcage position. This column is being driven by other units of your body. I want you to understand that. Most of you will have problem with disc herniation because you have forwardly rotated pelvis, either on one side or both sides, or you have pushed forward your pelvis due to lack of strength of your ligaments. Therefore, you either have anterior pelvic tilt, or you have sway back posture, or you have asymmetry right side of your body. Kind of you are in this position. Both of these conditions are contributing in the long run for developing herniation of the disc, because compression forces are greater on the posterior part of the disc when you have this misalignment of pelvis, as opposed to neutral position of your pelvis when you have zero compression forces on the posterior part of the disc. When you have a neutral pelvis, a neutral spine, the distribution of load goes directly to the center of your discs and through the center of your vertebra. That's why we are suggesting to fix your pelvis first by using your leg, and do not do anything with your lower back. Don't try to round your lower back. So now let's jump into the exercises and my suggestions, what you should try at least to do at home.
So this exercise meant to help for all kinds of individuals with all kinds of disc herniation in lumbar spine. So lie on your back, put your heels on the chair, and put the ball between your knees and gently squeeze that ball. Make sure both of your knees and hips are parallel to each other. They're not spread away. So the next thing, you should push your heels into the chair. It shouldn't be a soft surface. It should be actually it should be a hard surface. So put your heels into the chair and elevate your pelvis up from the floor, and just for 1 or 2 inches, not higher. And feel that your lower back is still connected to the ground. Don't elevate your lower back off the floor. And feel that your hamstrings are basically engaged, and feel your heel bones. That's it. Hold that position with elevated pelvis, and from now, inhale through your nose and strong, long exhale through the mouth. You should exhale all of the air that you have in your lungs, and after that wait for 3 seconds. Feel that you have tension in your abdominal muscles inside inner obliques. Wait for 2 seconds, and after that do small, just enough of it, small inhale through your nose, only through your nose. And again, exhale. 1, 2, 3. Inhale. As you can probably notice, you should definitely emphasize the exhale, not the inhale. The next exercise meant to decompress your right side, your right disc herniation. In these cases, when you have this asymmetrical posture with you getting stuck on the right leg, so you are decompressing the right side of your body by this movement. Line the left side of your body, align your right hip, your right leg with your torso with one line, flex your left hip as I showed. Now put a bolster or big pillow underneath your left abdominal wall, so your right abdominal wall will be completely decompressed and the left one will be squeezed, and put the pillow under your head. Now be in that position as long as you want to be, and just breathe through your nose, breathe out through your mouth, and try to pump up with the oxygen, with the air, your right chest wall. Although you are not exercising some of the particular muscle groups, you are passively decompressing the right side of your lower back.
And the last but not least, I would dedicate this combination of 2 exercises for those individuals who are suffering from the left herniation, the herniation of their discs on the left side of the body. So I will leave the link down below for these exercises. I have already uploaded them to my YouTube channel. Nevertheless, in the first exercise, don't forget you have to lift your right foot off the wall. And the general main task of these 2 exercises is to rotate your left hemipelvis backwards back to its neutral position. Therefore, by new position of your left hemipelvis, your left hip flexors will be shutted off. Therefore, the hip flexors cannot compress anymore that strong on your left disc herniation. So as you understood, Both sides of your body shouldn't be treated equally. The left side of your body and the right side of your body, they are asymmetrical. Therefore, there is different exercises for left and right side. I will explain these nuances in depth somewhere in my next video, so stay tuned. Another thing to remember, that these were beginning entry-level motions, and you definitely need to work with a specialist who knows how to apply these techniques with the patient with disc herniation, because it's pretty difficult patients. You need to take into the consideration a lot of things simultaneously. So you can hire me, we can work together via online, or you can come to us and visit us in Poland, so we will help you in person. And the last thing, if you are doing, either you're doing postural restoration physical therapy or you're doing McKenzie protocol, and within 3 months you don't feel any relief of your pain and symptoms, you are definitely, in these cases, you are definitely need to visit your neurosurgeon, because at times the last resort, the last and one and only solution is actually to do the surgery. There is the reason why there is so much surgeons and there is so much procedures to trim off your disc, the herniated disc, because it simply works at times, okay? So, but as I said, it should be the last resort for you. I will see you in another video. Thank you.